Hi, welcome to my channel. I'm Marciano. Make sure you hit the subscribe button. Make sure you like, comment. If you have any questions or anything, make sure you drop them in the comment box below so I can answer your questions. I've been getting a lot of questions about billing and coding. A lot of people think it's the same thing. It is not. Billing and coding is two totally different jobs. So today I wanted to make a video about billing and coding. How are they similar and how are they different? So billing and coding is a part of the revenue cycle process in a healthcare facility. So they go hand in hand, however, they are separate jobs. So if you know how to bill and you know how to code, that'll make you extra valuable to employers because you will know how to do both. So first, I'll get into billing. So billing is more so the aspect of dealing with insurance companies. Billing is when you send off the insurance claim to the insurance company. They're going to either send it back with the money paid for the claim, or they're going to deny the claim, or they're going to need some extra information about the claim before they pay it. So the insurance person or the biller deals with a lot of the insurance carriers and a lot of insurance aspects of co-payments, A&R, or collecting payments from patients if they're behind on their bill. Getting in touch with insurance carriers to give them information about payments to make sure that they send the money to the practice for this specific service. So all those things goes into billing. So in regards to coding, coding is when you apply the appropriate codes to the medical chart. So let me give you an example. So every time you go to the doctor is going to write what's going on with you. Let's take me, for example, Marciana. So I go in, I'm coughing, I'm sneezing, I have a fever. So I go to the doctor. So once the doctor sees me, he's going to write on the notes, hey, 23-year-old female comes in, she's coughing, sneezing, she has a fever. I'm going to run tests. So, and then once he runs a test on me and things like that, he sees I have the flu. So he's going to diagnose me with the flu. So I came in because I'm sneezing, I'm coughing, I have fever. Bam, he determines I have the flu. So let's just say he gives me a flu shot for the flu. So as the coder, I'm going to read the chart. I'm going to see where this patient comes in. The doctor diagnosed this patient with the flu, and the doctor gave this patient a flu shot. So as a coder, what I am going to do, I'm looking for the diagnosis. So the diagnosis is going to be the flu. That's what the doctor diagnosed this patient with. The patient has the flu. So then I'm going to also look for any procedures that were performed, anything. So the procedure that was performed in this instance was the flu shot. So now I have my diagnosis, and now I have my procedure that was performed. So I am going to go in my coding books, and I am going to go to the diagnosis book, because there is a book specifically for all diagnoses that anybody could be diagnosed with. And then I have a procedure book, and that book is going to entail every single procedure that a doctor can perform. So I'm going to go and look in those books, and I'm going to find the code for the diagnosis of the flu. And then I'm going to go in the procedure book, and I'm going to find the procedure for the flu shot. Or I might use what we call a HCPCS book, HCPCS. And that book has medical devices, injections, immunizations, and things like that, where you can code those as well. So as the coder, I find the appropriate codes, and I attach those codes to the claim. Once I attach those codes to the claim, that's when the claim goes off to the insurance company, and the biller does the biller's job. So as the coder, I am making sure that the codes are correct. And the reason my job is so important as a coder is because if I don't apply the appropriate codes, then the insurance company is not going to send the correct amount of money to the practice. That can cause your practice to lose revenue. That can cause your practice to get audited. and a lot of things that can happen to your practice for not applying the appropriate codes. So that's what the coder does. Those are two separate jobs. You have a biller, you have a coder. Sometimes the biller can do both, sometimes the coder can do both. So there are two separate different certifications for both of those fields. So I'll first talk about the salary for those. The average salary that I looked up for billing is anywhere between $45,000 and like $58,000. So billing is definitely good money. So for coding, the average salary came out to be about $48,000 all the way up to about $84,000. So coding is a little more money, and it also depends on which certification you have, which setting are you in, whether you're in an outpatient, inpatient setting. It depends on if you have multiple certifications, which city or state do you live in. So your geographical place also matters as far as your pay. So there's a lot of things to factor in, but one thing is across the board is billing and coding, and medical care or the medical field or the medical industry is a very good field to be in because it's not going anywhere and you're always going to have a job. As long as doctors are seeing patients, they're going to need someone to bill and they're going to need somebody to code. So those were the difference in between billing and coding, the job description for those both, and the salary. So now we'll go into the different certifications that you can get. So there are two popular organizations when it comes to coding. There is the AAPC, which stands for the American Academy of Professional Coders. And then you're going to have AHIMA, which is AHIMA. And that stands for the American Health Information Management Association. So those are two main organizations when it comes to coding. Most of the times when you're searching for coding jobs, then you're going to see two organizations that they're going to ask you to have a coding certification for the majority of the time. They're going to ask for the AAPC or the AHIMA certification, either one. So the AAPC offers so many coding certifications. The most popular certification that the AAPC offers is the CPC, and that's for the Certified Professional Coder. So if you're looking into getting to coding, you're not sure which certification to get, if you're going to go through the AAPC, that is the most popular one through the AAPC. And that mainly makes employers aware that you know how to code each specialty. Because on the exam, you're going to go over each body system. You're going to go over all the coding guidelines when it comes to the different body systems, comes to the regulatory rules and things like that. So the CPC allows them to understand that you know the basics of coding. So AHIMA, that's more so for inpatient and coding as well. So of course, you know, there is outpatient settings and there is inpatient settings. Outpatient is more so like doctor's office, same-day surgeries, things like that. Inpatient is when you're getting admitted into the hospital and you're staying overnight. So there's differences in coding when you're coding for outpatient and when you're coding for inpatient. So like again, you can check out aapc.com or AHIMA, AHIMA.org. They have different certifications, different specialties. If you find that you like cardiology better, then there is a specific certification specifically for cardiology or urology or OBGYN. So once you get into coding and you kind of feel your way in or feel your way around, and you're kind of see which specialty that you like the most. For me, I love geriatrics, or I love E&M coding, and I also love OBGYN coding. I like repetitive coding as well. Being that if I'm doing OBGYN coding at a doctor's office or a practice, I know all of the patients that are coming into this office, all of them are getting gynecological or obstetrics services. So everybody's going to use basically around the same codes. So those are the different certifications. And then, like we talked about billing earlier, there is a specific certification for billing. It's called the Certified Professional Biller, or the CPB, and it's offered by the AAPC. So now let's talk about how to prepare to get those certifications or prepare for the exam. Now, there are a lot of different routes that you can take. You can self-study. A lot of times, if you've been in the medical field for a while, or if you've been in this industry, if you're familiar with medical terminology, familiar with billing terms, familiar with a little coding, things like that, then sometimes you can self-study for these certifications. Now, the AAPC recommend that you have experience in this specific industry, but it's not required. So you can self-study if you would like to save money, or if you feel like you are disciplined enough to, get you a book or a study guide, Google things, look at YouTube videos. If you feel like you're that disciplined enough, then there is that option to self-study. You also have the option of trade school. I see a lot of people go to school for billing and coding, 9-month courses. They're normally anywhere between $12,000, $17,000 for a trade school, or for a vocational school for billing and coding. If you're going to take that route, when you go to the trade schools, like I'm from Memphis, Tennessee, so my hometown has a trade school, Concord College, and they have medical office, things like that, and they have billing and coding. So whenever you go to a trade school, whether you're calling, whether you're checking it out, if this is the route that you're going to take, make sure that this course allows you to prepare for the specific certification that you're looking for. Make sure one of the questions that you ask, does this course prepare me for an AAPC certification, or does this course prepare me for an AHIMA certification? If it does not prepare you for one of those courses, then you may want to hold off and do a little more research. So when you're going to these trade schools, make sure that the certification they're offering at the end is going to be through either the AAPC or through AHIMA. Now, they do have a certification through an organization called the NHA, and they offer a billing and coding certification as well. It's called the CBCS, which is the Certified Billing and Coding Specialist that they offer. So employers also may respect that one as well, but I'm just mentioning the AAPC and the AHIMA because those are the most popular, and not to discredit any others. So another one you can do is you can go directly through the coding organizations. Now, that'll save a lot of money because trade schools can be expensive and you're going to spend at least 9 months there. So if you're going to go directly through a coding organization, you can go through an online course if you don't have the time to sit into a classroom, or you can find an approved instructor in your area, that has on-site classes. So if you're going to go through the AAPC, and I'll speak more heavily about the AAPC because I am a CPC certified coder through the AAPC. So I can speak more so about the AAPC because I have direct experience or relations with them. So if you're going to go directly through a coding organization such as the AAPC, then the course is going to be for 16 weeks, 4 months. They're always having discounts. They're having sales. So the average price of the course is about $3,400, but they normally have discounts and they have specials that they run a lot. And so you'll end up paying about $2,000 or $2,500 for the course, and which is 4 months. And it's a self-paced course. Whenever you log in, complete the chapters, it's different modules. And if for some reason you get sidetracked and you need more time than those 4 months, then what you can do is you can pay an extra monthly fee, and the AAPC will give you extra time for that course. So you can prepare for that in 4 months, and then you can study for the exam, pay for the exam, take the exam, pass, bam, you're certified. So what you're going to need for the course, you're going to need, if you're going to study for the CPC exam, which is the coding, you're going to need 3 books. You're going to need the ICD-10 CM book, which is the book full of diagnosis. You're going to need the CPT, Cat Paw Tom, and that's the book full of procedures. You're going to need the HCPCS book, HC, PCS, And that's the book we talked about earlier with the immunizations in it, the vaccines, the medical devices, the medical supplies, and things like that. Because there are codes for that as well. Medicare also have their own codes. If you need a walker from Medicare, a bedpan from Medicare, anything that you get, there's a code to it, and you can apply the code in your practice or your hospital or whatever setting you work in can be reimbursed for whatever supplies or devices that you give to patients. So a lot of people ask, and as I'm wrapping up this video, don't forget, like, comment, and subscribe. Whatever questions you have, if I did not answer it in this video, make sure you drop the comments down below. And I'll put the AHIMA link and I'll put the AAPC link as well in the description box so you can kind of check it out. And if you have more questions from there, you can always drop it down below and I'll make another video, or of course I'll respond to your questions. So another thing people often ask me, well, is coding in high demand? Is this something that once I get certified in, I'm not going to find a job? Because I know some coders who are certified and they're still looking for jobs. Now, this is my thing that I tell everybody. When people tell me that they're in the same field as I am, or they're in the same field with someone else who hasn't found a job and they're concerned about that, you have to take a lot of things into factor when people say they can't find jobs. So when someone tell me that, oh, if I were you, I wouldn't take that course because I took that course 10 years ago and I was never able to find a job. My first question is going to be, do you interview well? What does your resume look like? Are you personable? Did you have the experience they were looking for? Did you have the personality they were looking for? So I would factor in all of those things before I take into consideration that someone can't find a job and they're certified in a certain field. So don't just go off someone's word. Of course, take heed, listen, take mental notes, but do not let that be the determining factor if you're going to pursue a certain dream of yours or not if someone else wasn't successful in it. So coding is in very much high demand. What made me get into coding is because I was looking for a career change, and I had friends I spoke with. I was actually going to try to go back and pursue my master's degree and things like that, thinking that would bring more money. And I ended up talking to one of my friends in healthcare. I didn't know exactly what she did, but I knew she worked dealing with the financial aspect. So when I ended up talking to her about me changing fields, and she asked me, had I thought about coding? And I never thought about it, never had a clue that I would be interested in coding. So when she told me more about it, of course, I was more interested because it's not a lot of manual labor. Of course, there's a lot of mental work that's challenging. Well, that's cool. I like to think. I like to research. That's right up my alley. And then she showed me her salary statements from coding, and she was making over $100,000 a year as a coder. And she has the CCS certification from AHIMA, and she has the CPC from the AAPC. So those two things had me considering coding, and so I looked it up and researched it, and that's how I got into it. But back to, is it in high demand? Coding is very, 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 very much in high demand. There are sick people every day, and even if you're not sick, you still need routine checkups and routine visits, preventative health. So as long as there are physicians that are checking out patients, as long as there are seeing patients, as long as there are hospitals, healthcare facilities, physical therapy places, long-term care facilities, as long as there are places that render healthcare, coders are in high demand. So yes, to answer your question, coding is a very lucrative field. You can get into a lot of different things as a start as a coder, and you have job security. So once you get into coder, what would be your next step? So if you don't have experience coding, billing, things like that, and you're newly certified, what I will also do is I will look into entry-level jobs. And please don't expect to kind of work from home. Don't get certified just so you can work from home. It's very much possible that you can be certified and have a work from home job, but also take into consideration as well that it may not be possible. Don't get into coding just because you want to work from home. you know, because sometimes in the beginning, it may not work like that. It will, it may not. So don't hang your head on it. And so once you're newly certified, this is a new field for you. Don't be afraid to take entry-level jobs. Don't feel like you've done so much work. Now you're a coder, now you're certified. These jobs are beneath me. Once you get your foot into the door of certain areas, then a lot of other doors will open for you. Take entry-level jobs such as insurance verification, A&R, patient collections, denials, things like that, front desk coordinator, scheduling. So look for entry-level jobs like that just to get your foot in the door. And once they know that you're certified or you have certain skills or qualifications, then more doors will even open from there. So I hope you guys enjoyed this video, introduction to billing and coding. I gave you guys the insight on the job descriptions of both, the different salaries of both, just a lot of the differences, a lot of the same things, to kind of take away which one would be more for you as far as insurance, denials, appeals, being on the phone with patients, collecting money, things like that, or sitting behind the scene, reading medical charts and just applying the appropriate codes. Make sure you're abreast of the rules and the changes, because there are different changes and codes and deletions that come out every single year. So if you've enjoyed this video, please let me know down below. Like, comment, and subscribe again. Any questions or anything like that, please make sure you comment. Any future videos you would like for me to make, also comment down below as well. Make sure you check the description box, because I am going to leave some jewels in the description box as far as some different links to check out information regarding salary, billing and coding, description, and things like that. Thank you so much for joining me. See you again. Bye.